neatly moves on to our presentation from Debbie, Phil and Jayne. And perhaps they'll be putting their slides up, because that's talking about carers who are aged over 70. So nice there. And they're going to be doing that. So I think, Phil, are you presenting this, or is it a team effort?
It's a team effort, which is mainly Debbie.
Right. Good. Okay, then. Well, let's see your slides. And thank you very much, Katrina and Raphael.
Sorry, can you hear me, Jill? I'm just having all sorts of technical problems.
I can hear you and see your slides.
But can't see me, I think. Is that?
No, can't see you, but I can see the
Okay,
slides.
just bear with me a second.
I can see a picture of you, Debbie. So
oh, it's just so sorry, my computer's been driving me completely insane. Sorry, can you all just bear with me for a second? Can you see the first slide now, Jill?
Yeah,
I can't.
and we can see you as well, Debbie.
Oh, fantastic. Yeah. Okay. So actually a fantastic segue, I think. I think we would probably have a few answers to the question of why it's important that carers are getting older. But this is in this project I'm presenting on behalf of our team, Phil, Neil and Jayne. We're all at the Policy Research Unit on Older People and Frailty, which is, as you've heard, this collaboration between Manchester, Newcastle and the LSE. We're all in the Manchester arm, and unfortunately Jayne, who was going to present today, is unwell and unable to present, but hopefully I'll do her proud. So our project has been looking at the impact of Care Act easements on co-resident carers over 70 looking after partners with dementia. I can talk in the Q&A if anyone's interested in why we chose that group. But just to tell you very briefly what the easements were and why there are a number of projects across the country looking at them, why they are so important in policy terms. And this is because the Coronavirus Act included an unprecedented power for local authorities to temporarily suspend the majority of their adult social care duties required under the Care Act. And these suspensions were known colloquially as easements. And 8 local authorities enacted what were called either Stage 3 or Stage 4 easements in April 2020. These were all pretty short-lived. And they had all ended by July 2020. And in fact, this aspect of the Coronavirus Act was not renewed when the Coronavirus Act came under later scrutiny. So it's a particular policy experiment in a particular policy window. What our project was doing in this context was investigating the impact of easements on this particular group of older carers, but also on those responsible for safeguarding within local authorities. We have 4 work streams to the project. Semi-structured interviews with 48 carers from a mixture of easement and non-easement areas. Semi-structured interviews with principal social workers and safeguarding leads. So those 2 arms of the project are complete, and that's what I'll be presenting today. We have a survey which is currently in the field, and if anybody is interested in that, or particularly could help us locate respondents for that, we'd be very interested to hear from you. And then the other arm of the project is legal analysis, and I'll be presenting just a slide or so about that today. And to say again, apropos of the earlier speakers, we've been hugely assisted throughout this project from inception until now by our carer advisory group. So as I said, where we are now, we've completed the principal social worker and safeguarding lead interviews. We're a couple of people short, we have them lined up, but of the carer interviews, though I think fair to say that we are not now hearing anything new from carers in those interviews, although all data obviously adds to the nuance. And our survey is in the field at the moment. I'm going to present some findings from our analysis of the local authority and carer interviews specifically relating to carer needs, and then just outline some legal issues arising for you. So I think the most important thing to say is that similar actions were taken across local authorities in terms of rationing care under the height of the pandemic conditions, regardless of whether they invoked easements or not. And we are quite reassured in our finding. We're pretty confident of this finding in that, as far as I'm aware, all of the other research projects investigating easements have found the same thing, that in fact all local authorities were doing the same things, but only 8 of them invoked the legal protection of easements. So what kinds of things were happening? Well, firstly, on assessments, this was one of the most widespread changes, that Care Act assessments moved to virtual or telephone assessments. And in many of the interviews, Phil can talk more to that in the Q&A, but this was recognised by our local authority participants as an unsatisfactory state of affairs. And we can compare it to Mental Health Act assessments, which remained in person throughout the pandemic because of the legal challenge in January 2021. But in particular, things like the loss of the doorstep test, no eyes on households where there were unmet needs, and anxiety about households where neglect or abuse might be taking place. And many people commented to us on the circumstances of phone calls not being known. You didn't know who was standing behind the person or who was in the room when they were talking to you. Reviews also moved off to not being in person, and in at least one easement area, reviews stopped altogether. And in general, social work face-to-face visits stopped, except in the more extreme cases. The other thing that happened in quite a complex dynamic was that in-home care stopped in many cases. And this was often, but not always, at the request of the couple. We were only interviewing couples, but also local authorities. And this was because they perceived the real and present dangers of allowing carers in to put them at risk of serious illness and death. And of course, the risks of this virus to older people with complicating conditions was being communicated daily by government. Carers, this was both the perception and the reality. They were often young, they were moving from home to home, there were different carers in every day, there was no or variable PPE, and there was potential asymptomatic spread. But there was also a perception by recipients that poor quality care was being received, and so it might as well stop. It wasn't adding that much utility to people's lives. Some local authorities told us that without recipients declining to allow carers or other help in, that certainly more local authorities might have been compelled to enact easements. We also found that because of the furlough scheme, there was an unexpected supply of family carers to step in where formal care was stopped. But often where care continued, which it did, especially in the more extreme cases, this was often because people's needs were so great that they felt they had no choice but to put themselves at risk from COVID. There was then, when people did stop in-home care, follow-up was very variable, but mostly there was no or little follow-up. And some local authorities made occasional welfare telephone calls, but many simply left carers to self-refer in the future. This is a group that very often does not self-refer. So just to give you examples of that from some of our qualitative data, we talked about having a carer coming in the morning just to help her get showered and dressed. That was arranged for February, but of our own volition, we decided, because at that time it was still quite scary, you know, people didn't know how it was being spread, one thing and another, we delayed it. But carers, where the couple did not stop the care coming in, the carers never missed a day. They wore masks, we just got on with it. We couldn't have managed without it. I mean, we'd no choice, really. Of course, the other impact across the board on older carers and people with dementia was that day centres and respite care largely stopped. Many community initiatives, centres and offices closed, day centres closed, and groups moved online. I'll show you a quote in a moment, but just to say that our data shows that overall online is no respite for carers and is often a greater burden for them than, for example, a day centre. Respite in residential homes reduced significantly, except in the more extreme circumstances. But we also have a similar point about this, that respite isn't respite if it causes more stress than it relieves. I know Jill's centre has done quite a lot of work on respite care, and I think we would echo that. And I'll show you again a quote in a moment. And there was a general inability across the local authorities that we spoke to offer choice of residential care or respite. So just to demonstrate some of the kinds of evidence that we've got about these issues. Well, as a carer, there's no respite for people. There has just been no respite for people in this terrible pandemic. As a carer, I found it harder because I haven't been able to get out and have what I call, it sounds very selfish. I feel selfish when I say it, hasn't enabled me to have the respite, have a break from it. You're not getting a break from it. It piles up. I think if it had carried on, I'd have popped. I think I was getting depressed, a somewhat understatement from some of our carers. And here's another carer. I think that was the main thing, the loneliness, just not being able to escape. I'm dreading the time I can't leave him because he's not safe. You know, I had a few accidents with burning things, what have you, but I think it was the loneliness. The loneliness for me was the biggest impact. But where respite was offered or taken up, it really hasn't, for many, hasn't been seen as much of a solution. Sorry, that's to say not much of a solution. I know that I qualify for 4 weeks respite care a year, but I don't use it simply because when he comes back from the home, he was very dirty. His bottom was dirty. He hadn't had a shave for a week. They told me he'd just been pacing. He looked like a little old man, and he isn't a little old man. He didn't want me to go. He wanted to be able to see me all the time. I felt as though he felt abandoned. So while ever I can keep him at home, I don't want to take advantage of those 4 weeks away, somewhat Hobson's choice for one of our older carers. And here, the only arrangement, this is somebody who'd made use of respite care and how unsatisfactory it was. Only arrangement was outside 15 minutes a week, once a week. That was the difficult. You go through all the emotions of guilt, is she all right, and so on. On reflection, I needed it. I got her back after the 2 weeks. So a mix really, you know, it wasn't A1, because I was thinking from a partner sort of perspective, she's in a different environment. Are they looking after her? I can't access her, I can't check, and so on. You know, there was anxiety there. It wasn't a sort of total 2-week rest as needed, indeed it should have been, but at least it gave me the opportunity to get things that I'd not been able to. And this idea that online provision, there's widespread concern really we found in the social worker group that online provision being so much cheaper might be seen as a substitute, but we can say that for our demographic group, this really for many people just wasn't the case. You know, it's all right saying, oh yes, computers are this and yet that, yes, they're for people that can use them, people that can see to use them. But if you've got dementia, mental health problems, you try learning the computer when you're 70 odd. It's not that easy. It's not a good alternative, not at all. But I think the other important thing that we found was that there were just very high social risks in seeking help. So these age groups are not help seekers in any event, but boy, did the risks of this go up. So if people could no longer cope, they risked not being allowed to see their partner, being a sitting duck for COVID infection, very rapid deterioration, death if COVID got into the care home, which was happening in frightening proportions. There's a fear and lack of trust, and the stakes were just exceptionally high, especially concern about losing control and decisions being taken out of their hands. For example, not being able to return home from care home respite. So here is one person talking about this. And 2 of our friends, I say, their husbands went in for respite. Unfortunately, it was when everything went into lockdown. They've never come out. The home said, you know, they're still alive, but the home said, well, really they've deteriorated because they couldn't see family or anything, and they weren't fit to go home. So I am not prepared to let that happen. So in terms of the quality and consistency of care provision, contractors and care homes were often operating with skeleton crews, staffing challenges. And for some carers, quality of care was a real concern. And for some, care was poorly suited to need. Local authorities themselves found that they had little control over what was provided. They reported to us an increase in self-neglect, and in at least one case, neglect such that it led to a formal review. And direct payments rhetorically were put forward as a solution, but they were also privately recognized as not a solution for many in the service user group because of the lack of flexibility and over bureaucratic scrutiny. And just as an aside, none of our respondents that we've interviewed have used them. And a point that's been made earlier today by other papers, that overall those who fared better were wealthier, healthier, strong networks of social and community support. Those who had key points of contact of individuals they knew well could help them navigate in their points of need. So I just wanted to have a slide about the legal implications before we close, because we've been thinking about these a lot, and we're in the throes of drafting a paper about them. Without easements, there is a question about whether the actions described above that local authorities took across the board were likely to have resulted in breaches of statutory duty under the Care Act. And our analysis of this shows that there is considerable ambiguity as to what local authorities are actually required to do under the Care Act. Although there's a lot of guidance, there are varying interpretations as to what the law is, and very few reported cases, which leads to widely diverging views. And then we have to ask the question that if the actions taken by local authorities were in full compliance with the Care Act, is this desirable as a matter of policy? Are these statutory duties robust enough to protect carers and people being supported? But a side question here, and one that's potentially relevant for future pandemics too, is how should we interpret statutory duties in the face of people declining to have carers in-house when those carers potentially carried a risk of death to the recipients? We're in very tricky legal territory here about what a reasonable offer of care and support is in these circumstances. And then we encountered numerous moral hazards around the law, because the political and legal focus was on preventing easements, and this largely succeeded, rather than on challenging local authorities that had not enacted easements for their reduced service provision. But we think that there were potential moral hazards of challenging reduced service provision, because these would only have led to the enactment of easements and potentially even greater rationing. And we do ask what might have been the outcome for individuals of challenging reduced service provision in an environment where easements could be invoked. So the next steps for us in this research, as I say, we have a survey in the field and we'll be analysing that. We're aiming for 500 responses. We're working on a number of publications, including on that legal analysis that I've mentioned. We're working on some briefing notes for policy purposes. We've already made a submission to the all-party parliamentary group on dementia in their recent inquiry. And then there'll be a final report and dissemination, we hope, at the back end of July or a couple of months later. We're also looking at a future research project focused on this issue that we've uncovered about quality of care, wondering what people do when they perceive quality of home care to be deficient, how useful our mechanisms are for challenging provision under the Care Act as a way of ensuring or maintaining quality of home care. And if those legal mechanisms are not effective, what other levers exist to govern quality of home care? So those are the ideas we're thinking about, and we'd welcome any views on that. Thank you very much.
Great, and thank you, Debbie, and indeed your co-researchers as well. We've got a little bit of time for questions, so I'm just seeing if there's any questions in the text. I can see your hand. Oh, Gemma's clapping. Is there anybody with a question for here?
Oh, I see Phil's put the survey link up. So
yes, and Phil has put the survey
thank
link.
you very much, Phil.
Yes. Jose Luis, question from you.
Thank you much. Thank you very much. Really, really interesting. I was wondering if you have been able to think about the long-term consequences of what you've observed in terms of, obviously local authorities change very drastically and quickly the sort of the offer. And there are questions about whether that's going to have long-lasting effects in terms of supply, but also preferences in terms of service users, whether they, obviously they've gone through a very difficult sort of time, and whether this project is able to enables you to have a sense of how those preferences might change for good, or whether people are very happy to go back to the previous model once they feel safe in terms of the pandemic.
I'll let Phil answer on the local authorities, Phil, if that's all right, because I think you spoke to social workers and I think found that currently they're under even more pressure than they were then. On the individuals, it's very difficult to say, Jose. I mean, Jayne isn't here, but I think what she would say is that people are just surviving day to day, and I think it's, haven't and don't think about what happens next, really, particularly with dementia, which is a deteriorating illness. So things are changing for them throughout, but have felt very largely abandoned during the pandemic, this group of carers. Phil, do you want to speak about the local authorities?
Yeah, I mean, from the principal social worker's perspective, what was happening is that everything went online or over the telephone. And this is a much cheaper way of dealing with service users. But the principal social workers were very adamant that they wished to push back on going more to online and more to telephones. There was safeguarding issues. You couldn't see who was behind a phone or behind a laptop. But the principal social workers did relate that they were very concerned that actually, given that there had been this move, there would want to be some kind of retention. And with some categories of people, certainly the age group that we were looking at, it just wasn't sufficient. It wasn't in any way a direct replacement for what they had beforehand. When assessments were being taken out in person rather than online. So I think that's the main thing that I took from the local authorities, is that there's, I wouldn't necessarily, I think fear is probably too strong a word, but actually there was concern that there might be a big push for more assessments and other things to go online and over the telephone, when with certain categories of people it just was insufficient.
Great, thank you for that. Anybody else got a question that they would like to raise or a comment? Realise it's a lot to take in, but Debbie, it looks as though you've got some papers coming out and there, haven't you? And
can but hope, Jill. For all of those of you who are called on to review them.
Yeah.
The academic papers are in early drafts and not submitted yet, but we'll have policy papers coming out quicker.
Great, good. So if there's not anything, anybody else got a question? I can't see everybody's hand, so forgive me if you've got your hand up and I'm not seeing it, but if you are, and Gemma is saying that she looks forward to reading the papers, and Liz from Age UK has been saying that their research has been now in its 4th wave, so that's a lot, and we'll look at that for more data. So I think now I'm going to hand over to